Bună ziua, bună dimineața sau bună seara, oriunde și oricând ne-ați ascultat. Sunt dr. Răzvan Vintilescu, ne aflăm la o ediție specială de podcast, un mini-episod cu un invitat extrem de important. Suntem la Congresul de Diabet de la Timișoara în 2026 și îl avem alături de noi pe unul din oamenii, din cercetătorii, care au fost alături de cei care au inventat injecțiile pentru slăbit încă de la început. Profesorul Rizzo Manfredi din Italia. O să vorbesc cu el în limba engleză pentru că este, îi putem spune, unul din nașii acestor injecții de slăbit. So, Professor, I just told my audience that we may as well call you one of the godfathers of the obesity management drugs. Yes? Please tell us, how did this idea come to mind? When you've been in this field since how many years?
Well, everything started, I would say, about 30 years ago, and we started clinical work around 20 years ago. So it's a long period of time. People may think that we started last year, but it is not the case. Everything started actually with diabetes, since these drugs were very beneficial in reducing body weight in patients with diabetes. And because of that, because of this strong reduction in body weight, pharma companies, and we need to acknowledge that, pharma companies started to explore the potential use of some of these beneficial drugs in obesity only, independently of the presence of diabetes. And these drugs underwent such an extensive trial program. So it means that each single drug was tested in so many studies, so many clinical trials, involving thousands and thousands of patients worldwide. So once the drug is available in a pharmacy, before that, it has been extensively studied and tested, even in patients. So this is very important to highlight, since anyone should understand that these drugs are fully safe if they are available in a pharmacy in the market.
But nowadays, even in Romania, patients and doctors alike are afraid that if they do these injections, they will die, their pancreas would explode, their liver would fail, their thyroid will be abnormally grown or something like this. Have these side effects been studied? Are they real?
Thanks for asking, since there are a lot of confounding messages on these, generated mostly by the socials and the web. So it's actually totally the opposite. These drugs, they do protect the organs, they protect the pancreas, they protect the liver, they protect the heart. And so we are accumulating a huge amount of evidence in each single study that the pancreas is protected, we reduce the risk of cardiovascular events, we improve the function of the liver, we improve the function of the kidney. So actually it's totally opposite. If we give these drugs with a medical care, with a proper medical care, we improve the quality of life of these patients. Sorry, I need to emphasize, with proper medical care, so it cannot be a self-prescription, but anyone has to be followed very seriously by a doctor.
Are these drugs safe for somebody who has something like, let's say, a problem with their heart, a cardiac insufficiency, or a cardiac failure, or they have undergone surgery on the heart, but they are still obese, and it's logical that they will not go well in the years to come.
Yes, obviously these patients that you are mentioning are very fragile, since they already experienced important cardiovascular events, and their quality of life is obviously deteriorated. And here, in this context, these drugs, they improve the cardiac function. They make prevention for future cardiovascular events. So at the end, they are extremely beneficial for the heart and for the cardiovascular system. Sometimes these rumors are generated by the fact that there are mild to moderate gastrointestinal side effects. These are the side effects, the so-called adverse events that we have with the use of these drugs. Some nausea, some constipation, a very small proportion of patients may also have some diarrhea or vomiting, but these side effects are transient, number one, and number two, they are mild to moderate in intensity. So at the end, the percentage of patients discontinuing the drugs are very, very low.
Since you've been in the beginning in this field of the research, can you tell me, please, what's the main difference between, there are a lot of types of drugs, that are injectables right now. Yes. There is semaglutide, there is tirzepatide. Yes, there are some other kind of drugs that are now in the United States, for example, but in Europe they're not yet approved.
Yes.
What's the difference between them? Because the ordinary people, and please explain it to their language, the ordinary people don't understand why are there so many drugs? What do they do different?
Well, this is very important to explain. So for diabetes, we have so many drugs, but for obesity, in this context, actually, we only have 3 drugs, and although there is a lot of confusion. Liraglutide, which was the first present in the market more than 10 years ago, but liraglutide was a daily injection, which means that patients every day had to make an injection. Then there was an advance with the use of semaglutide, which was a weekly injection, and even more now there is another upgrade with the use of tirzepatide, which is still a weekly injection, but tirzepatide contains 2 molecules in one, since it's a double GIP and GLP-1 agonist. In other words, in very simple words, with one drug, tirzepatide, we do a multifactorial a beneficial effect in our body.
I mean, one other question that doctors and patients have, does this work on visceral fat also? If you have steatotic disease, you have a fatty liver, this is the main concern for Romanians. Romanians are concerned about their liver and about their feet. The heart, the pancreas, they don't exist in their minds. I don't know, but when you talk to them about their liver, everybody goes, I have fatty liver, I'm gonna die. Yeah. Does it work on a fatty liver?
It works so well. The data are huge. And indeed, because of that, the international medical agencies, I refer in Europe to the EMA, the European Medical Agency, they are starting to prepare the approval for these drugs in patients with hepatic disorders, even independently of diabetes and obesity. In other words, the impact of the benefit on the liver is huge. The message for me that I wish to leave to anyone is, please be followed by a doctor. Please do not go yourself to the pharmacy. Please do not order anything online because we don't know what you will receive at home. Please be followed by your doctor. Do all the proper examination. And if you receive these drugs, you will improve dramatically, significantly your quality of life.
Professor, in the end, I would like to answer me one question. Do you think that nowadays the society has made from obesity something normal, like a normal claim? It's normal to be obese, it's normal to be overweight, you're just a little bit puffy, you're doing great, And how can we fight this perception that it's obesity, it's normal, when we doctors, we know that it's a disease?
Yes. it became normal, as you are properly saying, since inactivity became normal, since improper food became normal, and so we do not follow anymore in any country the proper lifestyle. Our daily life is difficult, and therefore we do not exercise so much, we do not eat what we know that we should eat, and indeed in Italy we started to see a predominance of overweight and obesity even in adolescents, even in infants, that we never observed in Italy. In Italy, we used to have fresh fruits, fresh vegetables, good bread, good pasta, the Mediterranean diet with proper fresh oil. So even in Italy, we are dramatically changing the situation. The message here is simple for me. Please do proper lifestyle. Please try to act, to move. Please try to eat proper food. If you are not able to balance this with your lifestyle, go to a doctor and try these medicines with full relax, since they are beneficial and they are safe.
Thank you, Professor, for all your work and for these kind words to the Romanian people. Vă mulțumesc că ne-ați urmărit. Ați înțeles mare parte, sper, din ceea ce a vorbit domnul profesor cu noi. Rămâneți sănătoși!